Okay, so we start today with our COVID-19 update. We will talk a little bit about what is happening around the world. We will talk a little bit about Omicron and about the challenges that this variant is causing us. And then we will, of course, also talk a little bit about animals. But before I start, I would like to, unfortunately, let the people who are here, who don't know yet, find out that my dear friend, Doug Archer, unexpectedly passed away just a couple of weeks ago. And he was a tireless supporter of One Health and a very, very dear friend. All the One Health team will miss him greatly, as well as all his colleagues in HIPPOS and all the people who had the pleasure to meet him and to work with him and to listen to his jokes. There has been a fund that has been created to support graduate students. So here is the link. His department, I believe, his own department is taking care of this. And yeah, this would have been the best way to remember him and to keep his memory alive. So with this, let's get back to COVID. So we know, we hear, we are aware that there is a COVID surge. There is a significant increase of the number of cases worldwide. And basically, we can say that Omicron has surpassed Delta virtually everywhere. This is happening regardless of the fact that most nations in the Western world are vaccinated. So it's not only happening where vaccine is not available. These are the numbers that we see in countries that do not have high vaccine coverage. But certainly there's been a dramatic increase in many, many parts of the world. You can see from this comparison of these two graphs that here you see an increase in the number of cases worldwide. There's never been so many cases as there are now. And instead here you see the deaths, and you see that fortunately, and for the time being, the number of deaths does not shadow the number of infections. There are a series of reasons for this. We're not looking at a black and white situation. There are often many drivers around what we see in data, and we will try to address this in this combined seminar. So here you see the countries that are having the greatest number of cases, and the USA, the United States, is one of them. But virtually it's happening everywhere. It is clear that this virus is much more contagious than the previous variant. You can see apart from a significant increase in the number of new cases, you also see that there is an increase in the number of deaths. And so, as I said, the connection and how infection correlates with death is never easy to unravel if you don't consider multiple factors. So one of the things that this is causing is a dramatic burden on health systems everywhere. And basically, there appears to be a lower risk of hospitalization with Omicron, also because big part of the population is vaccinated. We don't have to forget this. But the numbers are so big that hospital admissions are rising, and therefore healthcare systems and personnel are getting overwhelmed. And they're actually getting overwhelmed from different perspectives, because there's not only the issue that the hospitals have been under enormous pressure over the past 2 years, and people are tired and exhausted, and pandemic fatigue was something we were talking about at the beginning. Now I would call it pandemic exhaustion, but also because of the fact that this variant is so contagious, there is an issue with the management of quarantine of staff. And so there's only so much quarantine that can be afforded, because or else you don't have enough staff to go and work in the hospitals. And so you realize how complex the issue is, because if there's too much quarantine and doctors and nurses have to stay home for 10 days, then you cannot have enough people working at the hospital to match the needs. And this we have seen even with other jobs, like with pilots. And there's been a crisis, an international flight crisis, because of pilots and air travel staff that could not move because of quarantine. And so there is a downstream effect of these overlapping quarantines that make things more difficult and more stressful. So when we think about what this Omicron variant is causing, we should remember that it is also causing a double attack on our healthcare systems that are already exhausted. And so we should, as a community, remember that we should do what we can to avoid getting infected, because more people get infected just becomes a bigger chain of infection that puts our hospitals under greater strain. Okay, here we are. Here is our friend Omicron. I don't know if you know, maybe some of you questioned, where did this name come from, right? Omicron, what a strange name. Well, it is the 15th letter of the Greek alphabet. You know that the first variant was called Alpha, the original strain, and then we had Delta. These other ones have come along, and Omicron has become then the official name. Omicron is widespread virtually all over the world. You see there are parts of the world that are not supplying a lot of data, but elsewhere you see in most of this hemisphere, in Europe, in India, in Asia, in South Africa, Omicron has become dominant. In some countries, it's up to 90% of what is being isolated. In Denmark, 93%. And so this variant is pushing Delta out. Now, I wanted to say a few things about the severity, or the perceived severity, or the understanding of the severity of Omicron. So first of all, unvaccinated individuals that get infected with Omicron are at risk of developing a severe disease. So I would not call it a mild variant. There is evidence that Omicron replicates more in the upper respiratory tract instead of the lung. And it does appear that infections are, of course, less severe in people who have immunity. And so overall, if you consider the contagiousness and you consider the pathology and the replication kinetics of the virus, we can't really say if this is less lethal than the other variants. I thought I would show you this ugly, not ugly, but let's say picture, just to show you this is what is growing in the upper respiratory tract, and this is what is growing in the lower respiratory tract in the lung. And you can see that here are the three variants, the original strain, Delta, and Omicron, which grows more in the bronchs, and it grows, you can see, compared to the other variants, less in the lung. But is this enough to say that this is not dangerous? I would not be so sure about this, and numbers will tell us. Certainly, there are quite a few reports that indicate that it is a less virulent virus. What happens when you get less virulent viruses? One of the things that happen in the immediate post-pandemic emergency is that these less virulent viruses become endemic. And you will have heard the word endemic many times over the past few days. And so we thought that we would maybe elaborate a little bit on it. So what does endemic mean? Endemic means a disease which is constantly present in the population and it doesn't disrupt society or the economy. And so we're talking about pediatric diseases like measles are endemic. They are kept abreast by vaccination, but the virus is still there, and so many other infections that we have in our populations. And as I said earlier, the lesser severity of Omicron might be the characteristic that we needed for the virus to become endemic. Of course, this needs to be paired with vaccination, because if the population is not immune, the virus cannot circulate without causing big problems. And so we are probably approaching that phase, but we have to bear in mind that Omicron is most probably going to be not the last variant that we will have to deal with. There will be variants that will emerge in the future, and we will just have to follow them and understand how they are kept abreast by the immune response and the herd immunity of the population. Yeah, I just wanted to show you this pretty phylogenetic tree, but of course, the original virus is on this side, and this is how the virus has evolved. And Omicron, as you see, is here by itself and is quite distinct from a lot of the other variants that we have seen in the past. And it would be, I think, it would be dishonest for a virologist to say that there will not be any more variants. There will be more variants that will come, but the more the population is immune, and the better we get at generating new vaccines, the more those variants can be kept under control. Now, I wanted to make a connection because Omicron was first identified in South Africa, and South Africa was stigmatized because of the presence of this variant, and they were also hurt from an economic point of view because all flights were stopped and so on. And I don't know how many of you know that the Spanish influenza, which happened during World War I, is called Spanish not because it happened in Spain, but it actually occurred elsewhere, the first outbreaks, but because Spain was not at war at the time, it was the country that first gave the news about this deadly disease of influenza. So I would just like to compare this story to Omicron and its South African origin, because if you remember this map from before, you'll see that South Africa has a lot of Omicron, but of course, South Africa has a lot of surveillance and has very advanced systems to test and to sequence viruses. And so is it likely that the virus originated in South Africa? We don't know. It is possible that it originated in some other part of Africa or some other part of the world. And that is the reason why it was called Omicron, because we try not to hurt countries with the stigma that disease can bring. Yes, this was just to say that there are not a lot of genomes that are coming out of Africa and of genome sequences, which is of course not their fault. It is because they are under, let's say, supported. But what we can infer from that surveillance is, of course, not comparable with what we can infer with the surveillance in other that is happening in other continents. Now, where does Omicron come from? Well, really, I don't think we know. What we do have at the moment are three hypotheses. The first one is the most interesting for me, which is that it evolved from a reverse zoonosis event. So the virus, the original virus, spilled over into an animal, maybe a mouse or a rat or a small mammal, and it circulated in that population for a certain period of time, and then it spilled back into humans in a completely different shape. The second theory is that the virus evolved into this new strain to evade the immune response while it was affecting a patient with an immunocompromised system. The third hypothesis is that the virus has been circulating in a segregated population without great movement and virtually no surveillance, and it has co-evolved in this direction, but we still do not know. The number of mutations that are present on Omicron were of great concern at the start because it transformed certain characteristics of the virus. And in fact, the immediate studies that were done were performed to see whether the antivirals that had been developed were still active because of the changes in the virus composition. And as far as we know, Paxlovid is still functioning and efficacious in presence of Omicron. But what happened with monoclonal antibodies is that the change, the diversity that Omicron held was not compatible with the neutralization activity of all the monoclonal antibodies that are available. And so there is one monoclonal antibody which works against the new variant, and others are under study. Okay, just a few words on immunity, because we are in a phase in which immunity, the word immunity, the concept of immunity can be quite confusing. So here are some nuggets from Johns Hopkins What is immunity? It is the protection that your body develops after an infection or after a vaccination. Usually, the more severe the infection, the stronger will be the immunity. And because questions have come in on whether you should still have your vaccine, even if you have been exposed to COVID, the answer is yes, this is what is recommended, because vaccination can enhance protection against future reinfections. We are assisting at a series of different scenarios because there have been different vaccines that have been used in a naive population, and then there has been infection and superinfection. One of the things that surprises scientists is that the duration of immunity is not as good as we would have hoped. And actually, this is not only linked to the vaccine-induced immunity, but also to the hybrid immunity, which is the immunity that you get with vaccination and infection. With Omicron, there is evidence that neutralizing antibodies from people who have been both exposed and vaccinated offers a good protection, but the issue of the duration of immunity is still a concern. We have touched this topic in other times as well, and personally, I think that this is going to be one of the biggest problems that we will have to face after COVID-19. And again, history helps us in this way, because after the Spanish flu, they wanted to see what was the effect of that pandemic on mental health. And so they went to Norway, because Norway was not involved in the war. And they did a survey in Norway, and they showed that first-time hospitalized patients with mental disorders attributable to influenza increased by an annual factor of 7.2. So it's not the first time that pandemics cause mental distress. And so we know that there are issues and concerns, I would say, about leadership burnout. People are rethinking their lives. They have found themselves in a completely different working and a completely different social environment, and it's really hard to cope and to put up with all these different changes. And I think that this is something that large organizations like UF should really keep in mind and consider. Also because it's not only the mental health of adults which is at risk, but it's the mental health of students which is at risk. And so there's not a lot of published work yet, but what is published shows that children that have been isolated due to the COVID pandemic are more prone to depression and of course stress and anxiety. So this is something that is going to impact our futures as educators, and I would say, you know, as parents and as members of the community. This is another study that shows the increased prevalence of anxiety and depression in certain countries. And you can see that the numbers are truly scary. I think that the graph speaks to itself. The black bars are pre-COVID. So this is what is being registered just now. Okay, a couple of words on vaccines. and vaccination. But just to show you where we are, where we are, the United States are here, are halfway along the graph. You see the United Arab Emirates is the country that has the highest vaccine coverage. United States is here in the middle. World is further down, but not that much. So vaccination is increasing, but it's not increasing as much as it should. Some European countries have implemented mandatory vaccination programs. Italy is one of them, for everyone over 50. And this has created enormous social tensions, but it was deemed to be the only way to take some strain off the healthcare services. And so on the back of this, many European countries are considering mandatory vaccination. And similarly in France, there are lots of restrictions for people who are not fully vaccinated and have not undergone a negative test. Okay, we get to the end of this first part of the seminar with a brief mention to animals. COVID-19 has appeared in hamsters in Hong Kong. In the same pet shop, 11 hamsters which had been imported from the Netherlands tested positive, and the hamsters were culled, and there was a lot of concern about the ramifications of this, I would say, unfortunate event. We believe that hamsters can be infected in real life settings. So that's another species that can get infected. The virus can infect people back. And therefore, the virus, the hamster virus, from what has been seen, can also cause sustained transmission in human beings. So this virus is jumping a little bit backwards and forwards, is capable of jumping backwards and forwards. There's been an outbreak in hippos in a zoo in Belgium. The animals were not particularly sick. They had runny noses, and both of them are well. And the last, let's say, peculiar species which has been infected is hyenas in Colorado Zoo. Hyenas are closer to cats than to dogs, Costanza discovered. And they most likely got infected from humans, because of course this happened in a zoo, and this is the first time that these animals get infected. I wanted to remind you that there are ever-evolving guidelines on how to self-isolate and how to self-discipline yourself. If you've been exposed to COVID-19, please look at the CDC website if you have any doubts. And with this, I thank you for your attention and pass the floor to my friend Sonia Rasmussen.
Great. Can you see my screen? Can you see my screen?
Yes, we can.
Okay, great. So I'm going to go through some of the most recent information about where we're at in the United States, and then some new hot off the press data on Omicron. And then if we have time, we can talk a little bit about kids. So this is where we're at. You can see these numbers going, the first kind of wave, second, third, and then Omicron outweighs any of them. Omicron is really much higher than any of the rest. Here you can see, we talked before, the orange was Delta. Remember how Delta completely took over, and you can see how Omicron starts edging in, and now Omicron is in purple, completely taken over. 99.9% of virus in the United States is Omicron. And here you can see a little different than what we saw before, where there were parts of the country that got really overwhelmed, and then other parts got overwhelmed later on. You can see the whole country has high levels of community transmission right now. And you can see that the effects on hospitalizations, and we'll compare this numbers of cases to hospitalizations later so that you have a little more information. Again, you can see that the people that are most highly affected for hospitalizations are older people, people over 65 years of age, but you can see even kids are sometimes hospitalized. Kids 0 to 4 is in yellow, kids 5 to 17 is in gray here. So I think this is really a telling graph, and you can really see the orange is people that are unvaccinated. You can see that's the hospitalization rates per 100,000 by vaccination status. So if you're unvaccinated, you really are putting yourself at risk of landing in the hospital. If you are fully vaccinated without an additional booster dose, you can see that you are also at risk. Not nearly as much, obviously, as being unvaccinated, but it really shows the need to get a booster. You can really lower your risk to a quite low level of being hospitalized, or in particular of dying, if you get that booster. So if you've been putting it off, go out there and get it. So to talk about deaths, I think this Kaiser Family Foundation health tracker is really helpful. You can see that pretty much this goes through October. You can see that in most age groups, COVID was a top 10 cause of death. And you can see, for example, in kids in August, September, October, during the Delta wave, it was number 7. Kids 5 to 14, it was 5 or 6. You can see in older people, it's been 1, 2, or 3 for most of the year. So COVID is still having a significant impact on our lives. So I just wanted to go through some of the updates on vaccines. You know that now boosters recommended 5 months or more after the second dose. I think when we talked last time, it was 6 months, but it's been changed to 5 months for both Pfizer and Moderna. And if you got J&J, it's 2 months after your first dose. Some big news yesterday, Moderna got full approval from the FDA for their vaccine. So now we have 2 fully approved vaccines, went through the full FDA approval process, the Pfizer-BioNTech and the Moderna vaccine. They called it Spikevax. I'm not sure that makes it so that everybody wants to get it, but that is the name. So, and then in December, I think after we talked last time, CDC stated a specific preference for mRNA vaccines over the Johnson & Johnson vaccine. Johnson & Johnson should only be used if someone's not willing or not able to get any other vaccine. So just somebody put in the chat, so we're going to go through these numbers. This is people that are fully vaccinated in the United States. You can see that of the total population, it's about 63.8%, 64%. But remember that kids under the age of 5 can't get vaccinated at all. So, you have to keep that in mind. There's some that aren't even eligible. So among people that are eligible, 67.8% are fully vaccinated. So then this shows about people who have not gotten the booster, if they're booster eligible. So this is sort of opposite. So this says, people 65 years and older, I've shown you that they continue to be at risk of even being hospitalized, even if they are fully vaccinated. You can see that 35.7% of them have not gotten their booster yet. And about half of the total US population who's eligible for a booster has not gotten a booster. If you're one of those people, you've been hearing a lot about COVID over the last couple of years, so please go get your booster. It's time. So I just want to go through this new CDC terminology. You may have heard there was somebody, Saad Omer was on NPR today saying that he didn't think it was very intuitive, and I agree with him. So this is a new CDC terminology for vaccinated persons. You're considered up to date if you've had all your recommended COVID vaccines, including boosters if you're eligible. So you're not up to date with your vaccines unless you've gotten that booster if you're eligible. Fully vaccinated means you receive your primary series. So I think it's a little confusing, but when you see this terminology used now, you'll know what it means. So fully vaccinated just means getting the 2 doses of mRNA vaccine or 1 dose of J&J. To be up to date, you need to receive the booster. So I'm going to go through a couple of recent MMWRs that tell us a lot about Omicron. And, you know, when we spoke last time, Omicron was just emerging and we had a lot of questions. And one was, is Omicron more severe, less severe, or same as others? And we are starting to get some data that Omicron, compared to the Delta wave and the winter 2020, 2021 wave, is less severe. So it's the highest number of cases, emergency department visits, and admissions were seen for the Omicron period, but they didn't see an equivalent amount of intensive care unit bed use. So if you had the same proportion of intensive care unit bed use as you'd seen with previous times, you would have seen much higher. We would have really been in a lot more trouble than we were. So now, is that, I'm still not convinced that some of that isn't that a lot of people have some level of immunity either through vaccination or through previous COVID, but it does appear, at least the cases that we've seen, that there is some less severity with Omicron. So also, if you look at those who are hospitalized, the mean length of stay, the percents admitted to an ICU, the percents that need a tube down their throat to help them breathe, and the 10% that died is lower during Omicron than previous periods. And here you can see in a picture. So I think if you look here, look at the number of cases versus this is proportion of cases versus deaths. You can see that we really did see a bump up here. We're not really seeing that as much with Omicron. So it doesn't mean Omicron's no big deal. There are still people dying of Omicron, but compared to the huge number of cases that we're seeing, we're not seeing as many deaths or as many hospitalizations as we've seen with previous waves. So I think CDC is now willing to say Omicron may cause milder illness, but the record number of cases is still leading to more hospital admissions. So we're still having a lot of physicians and nurses and respiratory therapists who are feeling overwhelmed. So the number of cases is 5 times higher. The number of daily average hospital admissions is 1.8 times higher. So important to stay up to date. Here you see them using that terminology. That means getting your booster and wearing a mask. This is not a time to say I don't need a mask anymore. So this is a paper that just came out today, and I included it because I think it provides more helpful information about the need for a booster. So what this did is looked at number of cases. So you can see the number of cases. This is the time when we started switching from Delta to Omicron. And this is in unvaccinated patients, fully vaccinated, but without a booster, and then people that were boosted. So you can see, even if you're boosted, you can still get COVID. And I think many of us now, you know, before I didn't really know very many people with COVID. Now this past wave, I know lots of people who had COVID, and people who've been, you know, vaccinated for a long time, who had their booster and were exposed oftentimes through their kids. You can see here, this is the cumulative hospitalization rate. So you can see, okay, Omicron's Delta wave, Omicron's coming up, and you can see unvaccinated people really have a high risk of being hospitalized. You see fully vaccinated without the booster, and then with the booster. So your chances of being hospitalized if you've had the booster is small, but not non-existent. And this one I think is a little more complicated. This is a ratio. So this is looking at the ratio of unvaccinated divided by fully vaccinated without booster. So you can see here, this is comparing people. So you can see before Delta came into our lives, you were about 5 times more likely if you were fully vaccinated. If the unvaccinated were about 5 times more likely to get COVID. You can see that that's dropped down. So the protection against getting a case is less than it was before. The protection against hospitalization is still good, but it's better if you are if you've gotten the booster. So it really shows again that being up to date, that means get your booster, is really important right now. So also last time we talked, we had just had the latest data on vaccines for kids 5 to 11 years old. They were being rolled out. And after CDC does that, they have a very intensive program of vaccine safety. And these are the data that they have looked at for vaccine safety. So they had data, at this point, there were 8.7 million doses, and kids, like adults, did have local and systemic reactions, pain at the site, redness at the site, sometimes a sore arm, sometimes fever, especially after dose 2. About 7.4% of kids that was reported, that there's a V-Safe program where you get a text every day for that first week and then every week for several weeks. Parents said that their kids were unable to do normal activities in about 7.4%, but they said it was short-lived, 1 to 2 days. Rarely did they need to see a doctor, so about 1.1 to 1.2% after either dose. So what about myocarditis? We know we've heard a lot about myocarditis in adolescents. There were 15 preliminary reports of myocarditis, 11 that they were able to verify and say they met the CDC case definition. So it's 11 in 8.7 million doses, so much less common than what we were seeing in adolescents. There were 2 reports of death. I keep seeing some sites saying that there's more deaths from COVID vaccine than there are in kids than there are from COVID. That's absolutely not true. And during this time, there were only 2 reports of death. They were both kids that had multiple issues and were in fragile health before they got the vaccine. And there were no data to suggest a causal association. So I'm just trying to look at my watch. I'll talk a little bit about myocarditis. We talked a little bit about this before. CDC now has released that in JAMA a full paper on the cases of myocarditis. So myocarditis is a rare but serious side effect of getting COVID-19 vaccines, primarily for males 12 to 29 years of age. It occurs about 1 in 10,000, 1 in 20,000 in this age group. It is a rare serious adverse event. And most commonly when we see myocarditis, it occurs after a viral infection, and it can occur after COVID-19, and it's just inflammation of the heart muscle. So this is the paper published by Matt Oster. He's a cardiologist that works at Emory and works part-time for CDC. So what they found is the median age, it was 21 years. Most were male. And that's because we think myocarditis may have something to do with testosterone. So you'd expect more males than females. The median time from getting the vaccine to when people had onset symptoms was 2 days, and it was more frequent after the second dose of vaccine. And here's what the reported cases by age group. You can see 16 to 17-year-olds had the highest rate. You can see the blue is Pfizer. Remember, Pfizer is not, Moderna is not allowed for kids under the age of 18. It's only approved for 18 and above. You can see that the highest risk is 16 to 17-year-olds, and then continuing at 18 to 24. You can see why we are not seeing, you can see this kind of drop off if you continue this and you say maybe not as much testosterone in younger kids. I think it's not unexpected that we're seeing so few cases of myocarditis in kids from 5 to 11. So what are the symptoms? Chest pain, pressure, discomfort, shortness of breath, palpitations, some other findings that cardiologists are familiar with. Most are hospitalized. Most only need non-steroidal anti-inflammatory medications. Not a lot of kids are having to progress to intensive care therapy. And this is something that's very different from the kind of myocarditis that we typically see from infections. A lot of a pretty significant proportion of those go on to heart transplant. None of these kids had severe enough disease to go on to heart transplant or getting extracorporeal membrane oxygenation or ECMO. So the outcomes, 98% were discharged from the hospital. There were a few that were still, 2% were still hospitalized at the time of the review, and none died. Again, this is different than what we see typically with myocarditis. So do we have time to talk about infertility? There's a couple papers about infertility that have come up. Okay, so the reason why I want to talk about infertility is this is one of those things that doesn't die, you know, one of those rumors that started off and it keeps getting people talking about it. And you can see from parents that said that they don't want to get their 5 to 11-year-old vaccinated, 66% of them say it's because they're concerned about their kids' fertility. So here you can see it was not helped by Nicki Minaj, who talked about her cousin in Trinidad who said his friend got the vaccine and became impotent, which is not true. And where did this initially come from? Well, it came from some people who have in the past worked on saying things against other types of vaccine. And they made the note that the spike protein has some similar amino acids to a protein that's in the placenta. And so by saying that, they said, well, maybe then if you have a vaccine to the spike protein, maybe it could attack the placenta. It was a hypothesis from the start. There was very little data for it. And of course, if that was true, then you would see loss of pregnancies when pregnant persons get the virus, because they're going to have a lot of spike protein. That's not been seen. And here I thought this was a good quote, mixing them up, that there's like a handful of amino acids are similar. Mixing them up would be akin to mistaking a rhinoceros for a jaguar because they're wearing the same color. So here you can see previously, the only data we really had to say anything about this, it's hard to prove a negative, you know, that it doesn't cause anything. We had data from the clinical trials where we could see that in the control group compared to the vaccinated group, there were the same numbers of pregnancies. There wasn't, you know, these were people that were told not to get pregnant. They were in a clinical trial, don't get pregnant because you're in a clinical trial of an experimental vaccine, and some people got pregnant. We know there's lots of unplanned pregnancies, but it didn't differ between the two groups. Well, now we have additional information. So this is one of the studies. This was looking at a prospective cohort study looking at vaccination. About 2,000 females were included. Their male partners were also asked to participate. They completed a survey every 8 weeks until they became pregnant, and answered a bunch of questions about things that might affect them getting pregnant. What was found, and here you can see the unvaccinated was the referent group, that there wasn't any reduction at all. So you can see this, if this would have been a reduction in being able to get pregnant, you would have seen this like 0.5 or something. And you can see there's no reduction at all. You can see the confidence intervals are actually relatively tight. So not after the first dose, not after the second dose. This is the chance of getting pregnant in an individual cycle, menstrual cycle. And same thing, males getting vaccinated did not hurt their fertility either, their chance of getting their partners pregnant. So this is another one. I just feel like since this has been such an issue for vaccine hesitancy, this is something that it's important to look at these. And again, they looked at clinical pregnancy, pregnancy. So this is clinical pregnancy is, I need to look at these definitions. The number of pregnancies out of all frozen, thawed embryo transfer. Pregnancy rate is if you had a positive pregnancy test, and then ongoing pregnancy is one that continues. You can see that there was no difference. These are the 95% confidence intervals. This is, if there was no difference, you can see none of these: biochemical pregnancy loss, clinical pregnancy loss, chance of getting pregnant in the first place. No different. These are people who had IVF. So I think this certainly is some good data to share with people if you know with people who are